welcome everyone. My name is Jennifer, and I work at Sacramento Public Library, where books are just the beginning. Thank you for joining us for Communicating with Your Doctor, presented in partnership with HealthNet. We are so excited to offer this to you and to have Dr. Harrod with us today. Before we get started, I wanted to mention a few things. First, the program is made possible through a grant from the National Network of Libraries of Medicine and is intended to help you learn techniques for heart-healthy living. This program will be recorded and shared on our YouTube channel in case you would like to refer to it later. With that, I am going to introduce Dr. Harrod. Dr. Harrod is currently the medical director for WellSpace Health. He received his medical degree at The Ohio State University and completed his internal medicine residency at Indiana University Hospitals. He practiced primary care internal medicine with a subspecialty in geriatrics, mostly in Colorado. In 2015, he was designated a fellow of the American College of Internal Medicine. He is an associate clinical professor at California North State University College of Medicine. Dr. Harrod and his wife Tammy each have 3 grown children, raising their families in different parts of the country. They also stay busy raising their amazing 14-year-old triplet daughters, Caroline, Jack, and Victoria. I'm going to pass it over to Scott.
Well, thank you. That almost sounds better than I feel like I am. So I want to welcome everybody. I appreciate you all being here. I want to give a shout out to you, Jennifer, Valerie, who I knew in our previous life at another company. Sarah, I don't know if she's on here, a stalwart for HealthNet Centene. I really appreciate the opportunity. Let me tell you just a little bit about me in addition to what she told you. WellSpace Health, as you probably all know, is a large FQHC. We're about 100,000 patients scattered around the metro area. We have our great CEO, Jonathan Porteous, who's very active in the community. I report to Dr. Vera, the CMO, who's also very active in the community. We have about 20 facilities, 15 of which give primary and specialty care, and I'm the director of that department. We are currently, as you can imagine, very busy rolling out the vaccines to our very many patients with a great deal of success. So we're super happy about that. I am not the type that likes to read a bunch of slides, so I typically kind of go through them fairly quickly. I just think of them as a foundation for a good discussion and hope I can have that back and forth with you. I've always said a good talk is like a good office visit, where you feel like you're engaged and you're back and forth and that you're part of it rather than just being lectured. So if you'll slap up said slides, I'll start on some of those. Unless you think that's an alien moon orbiting around me, there's a very vibrant, diverse picture behind me that I like to use as a background sometime, but I also kind of like feeling like I have the whole world behind me too. So talking with your doctor, or how to take an active role in your healthcare. Oh, also a shout out to the NIH. They supplied these slides for which I was grateful because I'm really not much at making them up myself. So thanks for that too, ladies. Next, please. You are an official partner in your healthcare team. Remember, this isn't about the doctor or people like me. It's really mostly about you. So in this role, you'll be expected to, next please, ask questions. You know, if your provider, because not all of us are doctors, many of us are nurse practitioners, we're physician's assistants, even the MAs and the nurses, we all don't mind being asked questions. We want to have a dialogue with you. If your provider isn't really comfortable with questions, you might need to keep looking, is my opinion. Next. Feel free to speak up. I really like to deal with people who not only are knowledgeable and motivated, but want to speak for themselves. I can't really help you if you can't tell me about you and what you need. Next. We'll talk about how to, that's a big question he's lugging there. I hope it's not heavy. We'll talk about how to get ready for an appointment. We will explain telehealth, which a year ago I had personally very little knowledge of, and now it's kind of become a big thing. So I'm really glad we're going to discuss that. And share information. Again, this is about sharing. This isn't about directing or controlling. It's about a dialogue between a couple people who happen to have different skills and different needs. Next. Make decisions with your doctor. Notice the with. It's not for your doctor or by your doctor. With is such a collaborative word. I really like it. And the next slide. Before you go to the doctor, create a plan. I must admit, I've been kind of frustrated in years past when somebody comes in and I'll say, well, what's going on? Well, my family made me come. It's like, well, let's kind of break through that. So I know there's a reason, right? Let's not try to drag it out of you. I have to tell you parenthetically, I did practice primary care internal medicine for 35 years. I did geriatrics for about the last 10 in addition to that. And I've done full-time leadership now for the last 5 years. So that's my background. I was on the East Coast. I've been obviously here most of the time in Colorado, sometimes in rural areas and sometimes in urban areas. So I guess I'd like to think I have a diverse background. Next. Yeah, list and prioritize your concerns. While I realize that a lot of folks kind of delay care and build up things, it's kind of human nature. There's nothing more frustrating for a provider than to see that legal pad with 10 or 20 different things on it, because it's not, honestly, it's not really reasonable to get that done in the appointment time. So prioritization, I think, is really important. And when people seem to have trouble with that, I'll often say, okay, I know you'd probably rather have skipped this visit today, but there's a reason you kept it. So when you woke up this morning, what was it you were thinking? I really want to get this done today, and try to focus on those couple things. Yeah, note health and life changes since your last visit. In other words, if you say, I just got out of the ER at Sutter, I kind of need to know that, because contrary to popular assumption, we don't always all talk to each other, and I don't have everything on your background without asking. And then life changes. It's like if you've moved, lost or gained a job, lost or gained a significant other, maybe lost a parent, which happened a lot in my practice. Those are really important things and good for me to know. Gather information to take with you. It does require some prep to have an effective visit. So next, please. Yeah, like other doctors' contact information. When somebody comes in and said, well, I think I saw a heart doctor. And I said, you mean you saw a cardiologist? Yes. Well, do you know who? Well, I can't remember. Do you know where? Well, it was over there on the west side. Do you have a phone number maybe, or some records? No. Well, then I'm pretty frustrated at that point, because I do need some kind of direction. Conversely, if a patient says, yes, I saw Dr. Blank at Sacramento Heart, because I know those guys and I know where it is, it's like that really helps me to understand, because immediately in my doctor brain, I'm thinking, I know these people, they're good people, they do good work, they care about patients, they will be communicating with me if it takes a few days to get me those papers. So that really helps the visit to keep progressing. Next. Insurance cards. That's more of a front desk thing than a me thing. But honestly, if you don't have your insurance cards and your ID and such like that when you get to the front desk, you probably won't get to me. And that would be too bad. Medical history. Most people can kind of recite it by heart. I think most of us, fortunately, are blessed with generally good health. So I don't have to bring the 3 chapters of War and Peace. But if you have to, please bring that, because it's helpful to know. Next. Yes, medications. This is probably, if I have a pet peeve, it's that. I'll say, what do you take? Well, it's always the white pill, right? It's like, I never did check to see how many there are, but there must be 100 white pills. So either bring in a list, or I was happy if you brought in all of your meds, including supplements, vitamins and eye drops, like is mentioned here, because especially in geriatrics, if there was a problem, it was usually because of the medicine. The wrong medicine, doubling up on the medicines fighting with each other. So it was really easy for me to just pull all those out of the container. And sometimes there was more than one container. And I could look at them and see, well, this is good, or that isn't good, or it's full, or it needs refilled. You can learn a lot from just having those bottles right there. Next. Think about what you'll need to see, hear, and communicate during your visit. In other words, I shouldn't have to remind you, but like me and most everybody else, wear your glasses. If you're trying to read something to me and you can't see it, then it doesn't help very well. And especially the hearing aids. Now, if you're a geriatrician, you're used to hearing loss. That's just part of the game for people with aging. But I would often get what I like to call stubborn grandpa, now that I am that level of person. And they had hearing aids, but they didn't like them. They wouldn't use them. I don't know if any of you, I'm sure most of you are familiar with HIPAA, which is the Privacy Act. In geriatrics, that often goes out the window because you're talking so loudly to someone that they can hear you 3 doors down. So just wear your glasses, wear your hearing aids. It really does help us. Next. Consider bringing a family member or a friend. And I kind of like the word a, because it's a little intimidating when I walk into a room of 6 people. You feel like you're kind of being ambushed. And to be fair, honestly, some of those conversations require the whole family, typically something really difficult, like a new cancer diagnosis, end of life issues. Is it time for hospice? So, usually I end up a little bit in tears like everybody else, because those are really difficult, fortunately, one-time discussions. But in general, it's like, just bring the one person so the visit can be about you, the patient, not everybody. Because very often, I don't know about your family, but mine's less than perfect. And we sometimes step on each other, don't agree with each other, call emotional things out that aren't really relevant. So we want to keep things kind of clean and straight, if you will. Next. Ask your doctor for an interpreter if you need. One of my favorite things to say about Sacramento, since I moved here 3 years ago, is, do you know that we represent 40 languages in this metro area, second only to New York City. So there are a lot of languages. I know some French, I know some Spanish, but there are some languages I honestly had never spelled before. So it's very, very different. I'd like to tell you that for our providers, we provide interpreters over the phone in a dial-up, kind of an old-fashioned option. We also have software embedded in our color iPads for televisits, so it really helps with that. But we rolled the whole thing out last spring, right? And then people are coming to me and say, we don't have Urdu, we don't have this, we don't have Farsi. We were missing lots of languages that we had to add. So the feedback on that was great, and it was really amazing to see how many languages and cultures are represented here. Next. Having trouble seeing that because of the people on the side, including me. There we go. You may go to the doctor, I'm missing a word, at the clinic. You may be given your, oh yeah, okay. So you can either have what's called an in-person visit, the traditional trudge into the doctor's office and see them, or you can have a telehealth visit, which is either by phone, audio only, or video, audio, which is therefore voice and picture. It's either called telehealth or a virtual appointment or an e-consult. Those are all synonymous for a telehealth type visit. And I guess I will put in a plug for the audio only, because I know, like in our disadvantaged population, and again, that's pretty much what makes up WellSpace Health. a lot of people don't have video capability, or they're not comfortable with video because they're in a place that they either don't feel good about, they're not proud of, that's unsafe, that they don't want us to know about. So for a lot of reasons, sometimes for many folks, audio only is best for them. Next. So to do telehealth, you must be licensed in California. You must have an interactive audio and or video system. And these things I will tell you are all HIPAA qualified. In other words, there are software and encryptions built into this that hackers and other people can't get hold of it. So again, you may meet in a clinic so you can see a specialist, or you can have a scheduled telehealth visit. We have various options these days. And up until a year ago, I often wondered why telehealth was really unsuccessful. And I think it was because there wasn't really a need. But you may recall something happened last March that really made it a big need. So like for us at WellSpace Health, we didn't have a telehealth program at all. We piloted that in March, and in the first week we did 12 visits. By week 3, we did 1,000 visits. By week 5, we were doing 2,000 visits, and we are still doing that many. So we ramped that up in a big hurry because that was the need then. Next. Set your plan into action. Share your information with your doctor during the visit. Next. Start with your symptoms. So you might want to lead with, I think I have a brain tumor, when maybe what you should tell me is, I have a headache, because fortunately, most headaches aren't brain tumors, but unfortunately, in our human brains, we kind of go to the worst thing possible. I have a headache, it must be a brain tumor, it must be an aneurysm, how long do I have? So let's just start simple. Let's just start with, how do you feel? Tell me what the symptoms are and when they started. It's kind of funny that I've had, I can't remember how many visits where I'd say, well, what's going on? They say, well, I have pain. I say, well, where? And they'll tell me where, and I'll say, well, what kind of pain? Well, pain. Like saying it louder and looking at me harder helps me to understand. It's like I need some extra words. So kind of think about that. How often do you have, say, the pain? Is it all the time? Is it sometimes? What makes it better or worse? Those are big things that they teach us in school, is to kind of go through this checklist of what is it, where is it, how serious, severe is it, what makes it better, what makes it worse. In other words, if you say, I have a headache and it's only when I'm at work and I never have it on vacation or weekends, it's like, we pretty well know that's not a brain tumor, right? Next. How does it affect your daily life? That's really important. If I, as a white collar worker, have a little bit of back pain, it doesn't stop me. But if somebody who works with their hands and their legs and their feet, digging fence posts or something really heavy, has a significant amount of back pain, they probably can't go to work. So you have to factor in your daily life. What kind of work do you do? Where do you live? We're all different. Next. Go over your medications, which I think I touched on pretty hard because I just love it when people bring in their bottles. Not all the old bottles, though. I've often seen those from like the 90s. It's like, yeah, only the ones you're taking now. Next. Tell the doctor about your habits, please, and be honest. I've often said you can lie to your parents, you can lie to your spouse, you can lie to your employer, but it's not wise to lie to me. Because what we do talk about is privileged. Our relationship is just like a priest or an attorney. These are privileged communications. What you tell me can and should stay between us and in the room. So when I ask you about exercise, please don't inflate it. I can usually tell by other means whether you're telling me the truth or not. If I ask you about alcohol or smoking, your diet, please tell me the truth. Only then could I really help you effectively. Next. Voice your other concerns. If you say, this isn't a big deal, but let's just off the top of my head, my spouse made me come in and say her father died of X and so, and she's afraid I have that. That's important for me to know. It probably has very little to do with you or what's going on with you or what your diagnosis is. But if it's a concern for your spouse or significant other enough that they made you come in for it, I need to know that, because also their family histories that you might not think are relevant, that I find relevant. I'll never forget the time a young person came in and told me about a persistent headache, and he knew and I knew that his father had died of a brain tumor, but he didn't know his grandfather, who I'd taken care of, who also had a brain tumor. Now, I've never seen that before in my life, where there are 3 generations of people with a brain tumor. But between what I knew and what he knew, as we collaborated, we came to an effective plan, which was an MRI, which was blessedly negative. But another case I'll never forget. Next. Doctor-patient communication is a dialogue. I've mentioned it before, and it's not just a word, it's a thing. So let's get into that. So it starts with you share your health concerns. Good providers are trained to let the patient talk first and to let the patient talk for a little while. The average healthcare provider in America cuts off the patient in about 7 seconds. And I am as guilty as the next one. I'm guilty as charged. But especially after I got a little bit of gray hair and had done this for a while and took some feedback, not all of it nice, I realized you're better off to just be patient, take a breath, let that patient express themselves for about a minute. I've often said you can be in a rush, but don't act like you're in a rush. They're different things. Anyway, you share your concerns. Then your doctor asks you questions about the symptoms, like what we talked about. How much does it hurt? Where does it hurt? What makes it better? What makes it worse? You answer all those questions. Then the doctor is starting to formulate a plan in their head. And then they'll say, well, I think it might be this, it might be that. This is also the time for you to say, so I don't have a brain tumor? Because I have no idea sometimes until the patient's walking out of the room what they were really worried about. Anyway, so you ask questions to better understand the diagnosis and the plan that the provider has given you. And then the provider answers those questions. And that is about all it takes to have an effective visit. It's really not complicated. Next. Asking about medical tests. I'll start in on the providers. I've often told a provider, in fact, I did this morning, I said, don't order a test if you don't know what you're going to do with it. The shotgun approach to me is just sad. It's also expensive, and it makes healthcare more expensive and less meaningful. So I think a doctor or other provider needs to know why they're ordering the test and should communicate to you why they're ordering the test. If you say, well, I'm going to get a general blood panel just to check you over, I think that's fair. But if you want to order an MRI, then you need to be honest about, well, I'm kind of worried about your headache. It sounds a little more than a tension or a stress-related headache. So just to be safe, just to be sure, I think we'll get a scan. You need to know that a CAT scan involves radiation, and that multiple CAT scans involve enough radiation that it can cause its own problem. You need to know an MRI does not involve radiation, but it's noisy. My test for patients about claustrophobia was, how do you feel about being in a noisy coffin for a half an hour? Now, I have to admit, I didn't set it up very well. That was kind of blunt. But I do like to find out, yeah, you're going to need some Xanax for this, or no. So what will the test tell us? And I think importantly, what does the test involve? Next. Oh, I jumped myself. What does it involve? I kind of let that cat out of the bag. Next. How should I get ready? That's really good. People will say, This has happened 1,000 times. I want my cholesterol checked. Well, did you eat breakfast? Yes. Well, then I'm not going to get an accurate reading. You'd be amazed that most people don't know that they need to be fasting for cholesterol. Also, most people don't know they don't need to be fasting for almost anything else. But the cholesterol is a really important one. I had somebody stop by today who works here and said that she was missing her coffee because she was told she needed to be fasting for 8 hours before an ultrasound. And I'm like, well, I would have had the coffee because coffee's okay up until a few hours before. It doesn't have to be 8. Next. Are there any dangers or side effects? If you're sending somebody for a lung biopsy, you have to talk about the risks of collapsing a lung, needing further surgery, etc. Most tests, like I just talked about, are not dangerous and don't have side effects. Next. Questions to ask about the diagnosis. A good one. What may have caused this condition? Many things can be explained by health habits or genetics. And then, unfortunately, I often had to respond, and it was easier as I got older. It's like, you know what causes your arthritis in your knees. It's our gray hair and too many calendars. So, next. How long will it last? Is it permanent? People ask about blood pressure. It's like blood pressure is a condition. I have it. It's very common. It can be controlled, but it will last you all your life, and it cannot be cured. Same with something like cholesterol. Same with diabetes. People don't like to hear that. They want to hear that it's a quick fix and it will go away. But I think we need to be honest with each other and say, these are conditions that we are able to control, but they won't go away. But things like arthritis, it's like, I'm afraid more age does not make it better. Next. How is the condition treated or managed? I think this is one of the key discussions of any visit, especially the harder visits when we talk about a heart diagnosis, diabetes diagnosis, a cancer diagnosis. I have to tell you, often when I have told a person they were diabetic, it felt very similar to telling them they had cancer. I mean, it was something people really didn't want to hear. It made them feel badly. It made them fearful. There are a lot of things you can do, so it's good to get all that out. Next. How will it affect me? It's really important for a provider to realize that this person's main concern is not only how long will I live, but how well will I live, right? I think we're all, it's like, I don't really want to live to be 90 unless I can be a good 90, right? I don't want to just be hanging around the planet. So I think we all need to know, is this going to affect the length or the quality of my life? Next. And it's always wise to repeat in your own words, not just to the doctor visit. I'm reminded of leadership discussions. Instead of saying, well, I don't agree with that, it's much better to say, so let me see if I understand what you're saying, and you repeat it back and calmly say, did I get that right? Or did I misunderstand? Always stay calm, always give feedback, look each other in the eye, have a dialogue. You know, basically, I think in general, we're trying to be friends or at least acquaintances, but never enemies. Next. What are my treatment choices? That's a complex equation, and you have to throw in all these things. Does prevention help? What are the risks? What are the benefits? What are the choices? I often see in my head the scales. I'm not an attorney, but I often think of the scales of justice. It's like balance is a great thing, and I'm a Libra anyway, so it's kind of how I roll. But we need to put all that into the equation and see what comes out of the computer or, you know, my doctor brain. Next. And I've kind of talked about that. What are the risks and benefits? Next, Jennifer. This is really important too. I think any good provider understands that we're all different. If you're young or old, if you're male or female, If you're from a different race, a different country, a different culture, speak a different language, a different background, values are different. So understanding them, and I have to admit, the first time I was involved with anybody from a different culture, it was different for me. You know, you can't always be trained for the things that come into your exam room someday. So it's really best to say, what do you think? What do you want? What are your values? Next. Right, again, in closing, prepare for your appointment by writing down a list of your concerns. Please prioritize, it really helps. Share any changes in your history and a complete list of your medicines, or please bring them in. Make sure you understand what the doctor or provider is telling you. I feel dreadful if somebody tells me later on, I didn't really understand what you were saying. It's like, then I didn't do a good job. And then that was kind of a wasted visit. So, you know, make sure that you understand and that they understand. It needs to be both ways. But it often reminds me that nobody ever walked out of one of my exam rooms saying, you know, he was in the top 10% of his class at Ohio State. They don't care. You know, I thought it was important at the time. But unfortunately, patients tend to presume that your training is good, although unfortunately it always isn't. What they want is to relate. People would walk out of my room and say, I like you. I would like to come back. I feel comfortable with you. And that was always my gold star, because people don't really care how smart you are. It's an EQ thing, right? So next, if there is a next, I'm trying to remember. Yeah, take notes or ask the doctor to write down information to help you remember. I was big on that, even before there were cell phones. I would take a sticky notepad. I keep one nearby. Oh, you can't see it. It's my background. Anyway, trust me, it's in my hand. And it's sure true, so I figured it'd pop right out. I would write down a key name or a key word and say, look this up, read this up, Google this, whatever, talk to your pharmacist about such and so. Because you and I all know, if you're a provider, as soon as you tell somebody something, half of it vaporizes when they go out the room. So please take notes or ask for notes. I was always happy when a patient said to me, would you write such and so down? It's like, it meant they were listening. It meant they were engaged. It meant that this was important to them. Next. Okay, another shout out to the NIH, because I am not the big PowerPoint maker, but I kind of like to talk from them. So thank you very much for that. I believe, Jennifer, we have a video to show.
Health. Seeing your doctor on a regular basis is something most people know how to do. But talking with your doctor? Well, that's something else, isn't it? Today, you'll learn ways to make better use of the time you spend with your doctor. You'll get some tips about getting ready for an appointment, sharing information, and making decisions with your doctor. When this video ends, you'll be ready to make the most of your next appointment. Also, I'll use the word doctor, but I mean any healthcare professional you may see, such as a nurse, nurse practitioner, or physician's assistant. Now let's pause here to be sure you have all the materials you'll need for this video. First, it would be helpful to have the Talking with Your Doctor handouts that accompany this presentation. This information will help you recall some of the most important points that will be discussed today. If you don't have these handy, you can find them on our website by searching for Talking with Your Doctor presentation handouts. Throughout the presentation, I'll refer to specific handouts. The only other thing you'll need is a pen or pencil. The information in this presentation comes from the National Institute on Aging, a federal agency that is part of the National Institutes of Health and the Department of Health and Human Services. You can visit www.nia.nih.gov for more information on this topic. In the past, the doctor-patient relationship was one-directional. The doctor typically took the lead and the patient followed. Today, A good doctor-patient relationship is a partnership. As an active member of your healthcare team, you should ask questions. If you don't understand something, ask your doctor to explain it again. Your doctor may use technical terms and not realize they are unfamiliar or confusing unless you say something. Speak up. Tell your doctor if something is bothering you, such as a pain in your hip, shortness of breath, or other symptoms. Don't just wait to see if they will go away. Also, let your doctor know if you're unsure about a new medication or want to hear about a surgery or other treatment option that might be right for you. Taking an active role in your care puts the responsibility for good communication on both you and your doctor. Today, I'll help make it easier for you to ask questions and speak up by talking about how to get ready for an appointment, share information, and make decisions with your doctor. Don't worry about remembering every detail. You can find the information from this presentation in the handouts. There are often many details you have to remember before a doctor's appointment, such as every health issue you've had since your last visit, concerns you want to discuss, what medications you take and their dosages, what over-the-counter drugs, vitamins, and supplements you use. You might feel under pressure to fit everything in during the short time you have with your doctor. It's easy to see how you might overlook something important. The handout titled Getting Ready for a Doctor's Visit has a basic plan that can help you get the most out of your medical appointment. There are things you can do to prepare for an appointment so that you have a clear idea of what you want to accomplish and don't forget something important. Most of the tips I'll talk about are for regularly scheduled doctor's appointments rather than for emergency visits. Start by listing everything you want to discuss. If you have a new symptom or problem, make notes about how long the symptom lasts, what makes it better or worse, and how it affects your daily activities. It's a good idea to start this list at least a week before the appointment, so you have time to add issues you may have forgotten at first. Prioritize your list of concerns and highlight the 3 to 4 most important to discuss first, so that you don't run out of time to bring them up. The handout titled Concerns to Discuss will help you organize and prioritize all of your thoughts and concerns. Make notes of other health and life changes since your last visit, such as new illnesses, operations, and medical conditions, emergency room or specialist visits, changes in appetite, weight, sleep, energy level, mood, or memory, changes in medications or reactions to medications, a recent loss or move. You can ask your doctor's office for a medical history form before your visit so that you will have extra time to fill out this new information. The handout titled Changes to Discuss will help you to catalog what changes have occurred and when you first noticed them. Take the following information with you to the visit: names and phone numbers of any other doctors you see, even if you don't see them regularly. Your insurance cards. If this is your first visit with a new doctor, bring medical records and additional files, charts, test results, or any other information from your former doctor. Or have your new doctor's office contact the former doctor's office to get copies of your medical records. You'll need your old doctor's name and address. Bring a complete list of what you take, along with dose information. Or put your pills, drops, vitamins, herbal remedies, and any other supplements in a bag and bring them with you. But be careful not to misplace the bag. It's possible for medicines to interact, sometimes causing dangerous side effects. That's why your doctor needs to know about all the medicines you take, including medicines prescribed by other doctors. Things you buy without a prescription, like headache medicine, eye drops, vitamins, laxatives, herbal remedies, and other supplements. If you experience side effects, do not stop taking your medication without first talking to your doctor. The handout titled Keeping Track of Your Medicines will help you keep track of the different medicines, vitamins, and over-the-counter drugs you take. As you'll see, the chart has a space for you to record the medication name, what you take it for, when you started taking it, the doctor that prescribed it, what the medication looks like, how much and how often you take it, and any special instructions. For example, if you have to take it with food. So part of your preparation for a doctor's visit is putting together your list. Another part is thinking about the potential obstacles to communicating with your doctor. Wear your glasses and hearing aids and let your doctor know if you have a hard time seeing or hearing. For instance, you can ask your doctor to speak slowly. Consider bringing a family member or friend. If you do, bring a person who can take notes and help you remember what the doctor tells you. Make sure this person does not take too strong a role during the visit. You may even want some private time with your doctor to discuss something personal. Ask your doctor for an interpreter if you need one. If possible, explain your concerns to the interpreter before your appointment, so he or she can fully understand your situation before telling the doctor. You've prepared for your appointment by making a list of your concerns in order of importance to you, writing down your medications, noting all the changes in your health since your last visit, and wearing your glasses and hearing aids as needed. Maybe even practicing what you want to discuss with your doctor. Now you are ready to set your plan into action. When sharing information with your doctor, start from the top of your prioritized list of health concerns. Describe your symptoms in a clear and concise way to help your doctor diagnose the problem and decide what to do next. Examples might include pain, fever, a lump or bump, unexplained weight loss or gain, feeling depressed or sad all the time, problem sleeping, or diarrhea. Share with your doctor what the symptoms are, when they started, how often you have them, what makes them better or worse, and how they affect your daily life. Don't assume your symptoms like pain or fatigue are just a normal part of aging. The doctor needs to know how you feel. After discussing your symptoms, go over your medications using the list you created or the bag of medications you put together before your appointment. Let your doctor know if you've had any drug allergies or reactions. For example, did any medicine make you feel lightheaded, interrupt your sleep, or cause constipation? Make sure the doctor's office has the contact information for your pharmacy so that they can call in prescriptions. Try to use the same pharmacy for all your medicines prescribed by different doctors. The pharmacy tracks all this information and can notify you about possibly dangerous drug interactions. To provide the best care, your doctor must understand you as a person and know what your life is like. Your doctor may ask questions about what you eat or drink, how you sleep, what activities you do, and if you smoke or drink. Think of your doctor's office as a safe place to share information. It's best to tell your doctor the whole truth. Knowing your habits will help your doctor to understand your medical conditions fully and recommend the best treatment choices for you. Share any other concerns. For instance, tell your doctor about any major changes or emotional stress in your life, like a move or a recent loss, or if you're concerned about changes in your memory or thinking. The handout titled Making Good Use of Your Time During a Doctor's Visit offers tips that will help you make the most of a possibly limited time you have with your doctor. You'll give your doctor a lot of information during your visit, but you'll also get a lot of information. Asking questions about this information is very important. Here's how a conversation with your doctor might go. You share health concerns with your doctor. Then your doctor asks questions about your symptoms. You answer those questions. Then your doctor shares the diagnosis and treatment. You ask questions to better understand the plan, and your doctor answers these questions. Pay close attention to the last two items on this list. The conversation doesn't end after the diagnosis and treatment plan. Ask questions about the diagnosis, any words you don't understand, or instructions that are unclear. For example, if a doctor says something about an acute myocardial infarction, what does he or she mean? The correct answer is that acute myocardial infarction is a technical term for a heart attack. What about if your doctor tells you to take medicine with food? Does that mean before, during, or after a meal? Well, the answer is, it depends, which is why it is important to ask plenty of questions. Next, I'll talk about questions to ask your doctor. The handout titled Questions to Ask During a Medical Appointment has a list of questions you might consider asking. But remember, this is not a full list. Other questions will likely come up based on the specific conversation you and your doctor are having. Let's start with questions about medical tests. Sometimes doctors do blood tests, x-rays, or other procedures to find out what's wrong or to learn more about your medical condition. Some tests are done regularly to check for hidden medical problems, even though you don't have any symptoms. Before having a medical test, ask your doctor to explain why it is important, what it will show, and if insurance will cover the cost. If insurance isn't going to pay for it, you can ask who to talk to about the out-of-pocket cost. Some questions to ask your doctor before the tests are, what will the test tell us? What does it involve? How should I get ready? Are there any dangers or side effects? Find out how and when you will get the results. Arrange with your doctor to have the results of the test explained to you, allowing time for questions. If the test is done by a specialist, have the results sent to your primary doctor. Next, let's consider questions about your diagnosis. A diagnosis is what your doctor determines to be your health problem. It's based on your symptoms and the results of your physical exam and other medical tests. After the doctor gives you a diagnosis, here are some questions to ask. Why do you think I have this diagnosis? What may have caused it? How long will it last? Is it permanent? How is it treated or managed? And how will it affect me? Make sure you really understand your diagnosis and its implications. If you don't, have your doctor explain it again. Ignoring the diagnosis will not make it go away. Understanding your condition will help you make better decisions about treatment, and knowing what to expect may make it easier to deal with the condition. Have the doctor write down the name of the condition and any other relevant information for you. That way, you can refer to it later and share it with others. Ask your doctor if he or she can recommend any resources to learn more about your condition. Have you ever noticed that when you tell your doctor something, he or she may repeat it back to you to make sure he or she understood everything correctly? That's a great opportunity for you to correct your doctor if he or she has gotten something wrong. You can do the same thing when getting information from your doctor. After your doctor tells you something like a diagnosis or treatment plan, repeat it back in your own words. Sharing and receiving information are two important steps in a doctor-patient communication. A third is to make decisions about your care together. Talk about treatment options. Ask your doctor about all the ways to treat your health problem. There may be more than one. Discuss the risks and benefits of each one. This includes possible side effects, that is, unwanted or unexpected symptoms of the treatment. Also ask about how likely a treatment might work for you and what exactly it will do. Length of treatment, and if you need help from family or friends. And whether insurance will pay for the treatment. Have your doctor give directions in writing. Think about how each treatment will affect your life and ability to do activities you enjoy. Share your concerns so your doctor can work with you to develop a treatment plan that meets your needs. If a treatment makes you uncomfortable, ask if something else might work. If your treatment involves getting a prescription, make sure you know what to expect. You can find more specific questions about medications in the handout titled Questions to Ask During a Medical Appointment. Remember that a successful doctor-patient relationship is a partnership. To recap some highlights from the presentation today, as an active member of your healthcare team, prepare for your appointment by writing down a list of your concerns. Share any changes in your medical history and a complete list of your medicines. Make sure you understand what the doctor is telling you. Take notes or ask the doctor to write down information to help you remember. Although I didn't talk about them in today's presentation, you may want to look at the handouts titled Remembering What the Doctor Says and Health and Aging Information Resources for additional helpful information to review before your next appointment. Thank you for listening to this presentation today. I hope you found it helpful. For additional information on talking with your doctor and other free resources from the National Institute on Aging, visit the website www.nia.nih.gov and look for health information. There you can find more information about doctor-patient communication. You can also find a variety of other information on health and wellness, including materials about exercise and physical activity, making healthy food choices, quitting smoking, and other behaviors that can help you feel better and prevent or manage specific conditions. Or you can call the National Institute on Aging Information Center toll-free at 1-800-222-2225 to speak to an information specialist, or email us at niaic@nia.nih.gov.
Great, thank you. So we have a couple minutes for questions. If you do have a question, go ahead and unmute yourself and ask your question.
I have a question.
Please go ahead.
I have never heard that eyedroppers were important to tell a doctor. Why is that?
So without getting too doctory, actually some of them do interact with other medications. There's a large group of drops for glaucoma, which are beta blockers, which can affect other beta blockers you're taking, your heart rate, blood pressure. It's not likely, but it has been known to happen. So yeah, it's important to say.
Along those lines, is there anything that I should be aware of that something would seem as insignificant as that? Is there anything else that you would suggest that would be important to notify the physician?
Not off the top of my head. I mean, it's an important question at the start of a visit to say, especially when you know somebody. And most of my patients were repeat over years and years and years. I would say, okay, is anything different since last time? So yeah, eye drops are something that are frequently missed. And sometimes even the best providers don't think of it. But it's good to volunteer basically anything that's really new in terms of medications, your life, your relationships, your work. It all factors into the big picture.
Thank you, doctor.
Oh, you're welcome. Anything else?
I have a question, Virginia.
Hi, Virginia.
Hi. Sometimes I get out of breath, and I get dips. I can start in the morning with full energy, and maybe a couple hours later I get a dip. Usually I try to drink a lot of water and make sure I got some food in me and whatever medications I need at that time. I do have blood pressure issues. What kind of things should I be noting at the times that I have dips or shortness of breath?
So a couple big things.
Down?
Couple big things is, I don't know if you have any pulmonary history. And you think about the usual things like asthma, smoking, seasonal allergies. Like when people come in now and tell me they're more short of breath, it could be the overlap of allergies with asthma. Whether you had COVID, a lot of people who had COVID and thought they were better are what we call long haulers, where they have rather persistent shortness of breath. And this is a huge, giant experiment that nobody really knows how it's going to turn out. People will ask me questions like that about their COVID, and I'll say, ask me in a year, because right now we really don't know. We don't have much information. As far as the lows or the dips that you talk about, that's actually a pretty common question. And if you have high blood pressure, I would say check your blood pressure then when you're having those symptoms and note it, because very often we will find that it drops, and that's why you feel like you drop, right? They can kind of correlate. Another thing is, I don't know if you have diabetes, but diabetics should check their blood sugar. And sometimes those of us who don't have diabetes get hypoglycemic or low blood sugar. So to check that along with the blood pressure would be helpful information. Don't know if that helps, but it can be a long conversation there.
So what type of numbers for your blood sugar if you've eaten, a couple meals during the day and then you feel your dip? What kind of numbers are still okay?
So it depends. If you're fasting and haven't eaten anything for a while, your blood sugar should probably be 80 or above, not lower than that. If you ate, say, a couple hours ago, your blood sugar might be as high as 120 and you're not diabetic.
Oh, wow.
So kind of looking for that range.
Okay. Thank you.
You're welcome. Anybody else?
Hi, I had a question. Since we're discussing communications with doctors, our demographics are constantly changing. How often do doctors receive diversity training and refreshers on social determinants of health?
Well, no, on the one hand, I'm glad you asked that. And on the other hand, I'm a little embarrassed because in general, doctors across the country, the ones I've known, barely keep up with their own specialty, much less the social determinants that we are pretty much in tune with here. I am proud to say that WellSpace Health does diversity training at the onset of employment. And in fact, I sometimes give that talk. I gave it on Monday morning after Jonathan, our CEO, did his part. He said he feels kind of weird about being my warm-up band, but I kind of like it. So we have about a half an hour about diversity training, and we call it cultural humility because most of us come from a place of, well, my culture is best. And that's only because it's really the only one you understand. So it's important to be aware of other folks and their cultures. So we do train on that. And then we have a refresher every year at WellSpace Health. We have a very diverse population here. When people question that, and I have 25 new employees in the room, I ask them to just look around because it answers itself. We employ all kinds and we take care of all kinds. So people need to be sensitive to that. But what other companies do, I have no influence. And it's not mandated. It's not mandated by the state, which surprises me, or by the federal government. But I think it will be.
I was going to say that should change, but thank you.
Yeah, you're welcome. That's a good
Dr.
question.
Harrod,
Yeah.
Dr. Harrod, are you here in Sacramento? Are you taking new patients?
So I don't, thank you. I appreciate that. I don't see patients anymore. I'm full-time leadership. I supervise all of the primary and specialty care providers, as well as the SURE program and our interim care program. So I have about 45 providers that I have to tend, like having 45 kids sometimes. It keeps me really busy. And then there's always the surprises in life, like COVID and the vaccines. And so, no, I don't see patients anymore. Sorry.
Okay, thank you.
You're welcome. Long answer, right?
Right. Well, no, all these people would probably join or want to see you if that was the case.
I appreciate it. I enjoyed being a primary care provider. I have to say, after about 35 years, I felt like I could only change healthcare so much, one patient at a time. And now I feel like I have a different impact in my current role. And I think it's important to always evolve. And I never wanted to be the old guy that never changed. So I'm still trying to go.
Okay, thank you. Great,
You're
great
welcome.
presentation.
Oh, thank you. I appreciate it. You've all been very kind. More questions, please? I like
Yes,
them.
I just, my name is Gloria Torres, and I
Watching
just
you,
want
Gloria.
to,
You're
thank
next
you.
to my picture this morning.
I just want to thank you for the presentation. Someone that went through this whole journey, in 1999, I was diagnosed with leukemia, and how I wish then I would have had this information. And I just had to learn along the way. And one of the things that I really learned is that I had to lobby for myself, and I had to ask all the questions, and I had to do my homework. I had to repeat. I had to listen to the doctor when the doctor was showing me all these numbers that dealt with the white cells, the platelets, the red cells, and then knowing and understanding that having leukemia is a chronic illness, and it's something that I have to live with all my life. And how do I do that? What's that journey like? And I've just been so blessed to have a team of doctors and great support to get me through this journey. And now
You did very well.
yes, I live now, with the pill, and that's my life pill, and that keeps me in remission. So I thank you for this presentation. It really hit home in all areas, and someone that works in the community, someone that sees clients every day with a chronic illness. It's good to provide them this information, because I know many of us have seen someone come in with a bag full of pills, and a lot of them are outdated, and or they bring me their file of all their lab and everything, and we're sorting it out. So good information.
Right.
Thank you so much. Thank
You're
you.
welcome. You remind me that I have a lot of sayings. I might write a short story someday, but one of my favorite sayings is, okay, this is speech 247 for me. I can pull it out of my neurons, no problem. And I've given this 1,000 times. But the real key is, for this person sitting by me, it's the first time. And I think any good provider realizes that. We also need to realize, like with your diagnosis, that sometimes the discussion you have with that person is the most important discussion they might have in their medical life. When you're telling somebody you have diabetes, you have cancer, you have leukemia, for us, that's a diagnosis and it's numbers. But for you, it's like, this is your whole life, which just got stood on its head and spun, right? So I do understand. And we as providers just need to be way more sensitive to just the humanity of medicine, because we're dealing with people, not diagnoses, codes, and numbers. More questions?
I have another question, please, Virginia. Thank
Sure.
you. Hypoglycemia, is that certain numbers for your blood sugar, or could that just be a drop in so many numbers from where you're normally at?
Yes. It can be either one.
Okay, yeah, that's what I've been thinking. So how much of a drop would you say it would be for someone to feel it? My mother said she had it, and I witnessed it.
Okay. That varies a great deal from person to person. There is no, and I've always kind of prided myself on not being rigid. It's like I learned from the book, but now I don't, I toss the book out, because you see so much that doesn't fit in the book. And whether you're male or female, whether you're heavy or skinny, whether you're young or old, depending on your diet, your exercise, there's so much that factors into what you would think would be a simple answer. Because what people want to hear is, it should always be above this and never below that. Well, that's not how it works. So, but a drop of, when somebody comes in and says, I checked my sugar when I was feeling well and it was 110, and then I felt like crap and it was 70, it's like, that's probably significant. So I usually look for a drop of not 5 or 10 points. That's like blood pressure. People will tell me, well, it's 140, but yesterday it was 130. Doesn't matter. That's kind of in a normal range. There's a range. But if your blood sugar drops more than 10 or 20 points, like 30 or 40, that's probably significant, and it probably causes symptoms.
Thank you.
You're welcome.
Thank you, everyone. We are out of time. Thank you again for joining us for communicating with your doctor. And a big thank you to Dr. Harrod and HealthNet. Join us next month on April 30th for another presentation from HealthNet, Fit Families for Life. We invite you to explore additional resources on heart health in the library collection and the National Institutes of Health. For more information about our health literacy initiatives, curbside pickup locations, and upcoming virtual programs, visit www.saclibrary.org. For the Sacramento Public Library, thank you and be well. I will be emailing all participants the handouts and links used during today's presentation. So thank you, everyone.
Thanks, Jennifer. Thank you all. Appreciate your attendance.